The next presentation is by Dr. Maneesh Bapaye, Retinal Crescent Innovation in Diabetic Membrane Dissection.
Good evening. I'll be presenting this Retinal Crescent, which is an innovative instrument in diabetic or fibrovascular membrane dissection. Diabetic retinopathy and its complication is a major cause of preventable blindness in all parts of the world, including India. Various demographic studies from India have put incidence of diabetic retinopathy between 17.6 and 29% among diabetic patients. Advanced diabetic retinopathy with vitreous hemorrhage and tractional retinal detachment poses a significant surgical challenge to the retroretinal surgeon. Dissection of fibrovascular membranes is achieved by segmenting into smaller segments and then delaminating from the vascular apices. In era of small gauge vitrectomy systems, most of these functions are done by vitreous cutters. We introduce a newer instrument which helps in fibrovascular dissection management. So the instrument itself is made up of titanium. It has a handle and a shaft. The shaft which is 32 millimeters, and it has a tip which measures 0.6 millimeters and has angle of 45 degrees. So this is a tip. The tip is rounded and has sharpened edges, and it easily goes through 23 gauge cannula system. The tip enters between the fibrovascular membrane and the retina, and the sharpened edge can create clean dissection plane between major vascular adhesions of the fibrovascular membrane without causing any traction on the tissues. Either vitrectomy cutter or curved scissors can then be used to achieve segmentation and delamination of the membranes. The membranes does look like a membrane pick, but it differs because it has sharpened edges which allow it to have clean dissection without causing any traction. So this was the first patient who was 60 years old male with a chronic combined retinal detachment. Intraoperatively, as we can see, after initial dissection with the cutter, the crescent is used to create better dissection plane close to the disc. Once we get good dissection plane, the cutter can then be used to continue with the dissection and removal of the fibrovascular tissue. The secondary membranes can also be lifted easily, which could not be picked up with other methods. This crescent can dissect them and lift them from the retinal surface. Now this was a patient who had combined retinal detachment, so a lot of mobile retina is there. So this is the dissection, which at the end of dissection, as we can see, there was a large fibrovascular proliferation which was there. Second case is a 65-year-old female patient with chronic tractional retinal detachment and non-resolving vitreous hemorrhage. Here there is a fibrovascular membrane here in the supranasal quadrant. So after initial truncation of cone, we can use this crescent to lift the get proper dissection plane and without damaging the retina, and then use cutter. We can trace the second membrane right up to where it ends, and then start dissecting from there using this particular instrument. So again, we have to gradually use combination of instruments with the crescent as well as the cutter and achieve complete dissection. This was a third patient, younger patient with PDR. Here again, the crescent is used to create dissection plane, and then as we can see, this area of fibrovascular membrane is removed completely with cutter. So steps of diabetic vitrectomy include debulking of central vitreous, and then creating an opening in posterior vitreous cortex, truncation of PVC up to the edge of the membranes, and then segmentation and delamination. Segmentation, we can use cutter or scissors, which is used less commonly. The chances of creating retinal breaks are significant if we do not get plane of dissection properly, and the risk is higher in combined retinal detachment as the retina is more redundant and mobile. The retinal crescent creates an appropriate plane for dissection where we cannot insert the tip of the cutter or the edges of the curved scissor, as these the curved scissor tips can create a retinal damage or a retinal hole formation if we are not in proper plane. The sharpened edges can shear flimsy adhesions of second membranes can be created, can be dissected from the underlying retina, so basically this particular instrument can create proper dissection plane. It can dissect the secondary membranes which are underlying the large fibrovascular membranes and achieve more complete dissection as compared to just cutter. Sometimes we cannot really get removal of proper secondary membranes with the cutter alone. So this is an instrument which is an effective method for surgical management in proliferative diabetic retinopathy. It is meant to be used as a complementary instrument along with the already established instruments like cutter and curved scissors. Thank you.
Maneesh, congrats on that new instrument that you have devised. I was just wondering, we discussed that in personal communication with you also.
Yeah.
During our residency days, during our fellowship days, we used to have an instrument called the membrane spatula knife, which was a little longer in its length compared to what you showed, and it had sharp edges on the sides as well.
Okay.
So, the thought process that has come to your mind is definitely praiseworthy, but I think there existed an instrument similar to the kind that you are.
So I do agree, and that maybe so. Before you told me yesterday, I had not come across this instrument.
Okay.
But if I'm not wrong, that era when all of us did fellowship was where we are using it for 20 gauge, where we could pass this through. While this particular instrument, there we had lot of instruments like curved scissors, 20 gauge were there. This instrument is compatible with small gauge vitrectomy systems also, and that particular spatula knife that you are talking about, I think will be obsolete in today's case scenario. So this was a.
Is there any increase the iatrogenic rate?
Sorry,
here?
I can't hear.
What are the rate of iatrogenic tear, because the edges are very sharp. So while dissecting the membrane.
The edges are, for one, the edges are sharp enough that they can shear the fibrovascular thin tissues, but it doesn't cut through the retina. One. Secondly, if you look at the bevel is directed upwards. It is not directed downwards. So the area which is coming in contact with the retina is not sharp. It's something which is flat. It is blunt, so it doesn't really cut the retina very easily. As it was used more often, the edges did become blunt, and I had to get them resharpened. But there was a tendency to cause a bit of pull, but it really didn't create any retinal tear when you are not over enthusiastic about cutting it.
What is your experience in combined detachment cases?
Madam has a question.
After we score him, I guess. What is your experience in the cases that you have done in the combined detachment cases?
So combined detachment cases, there were two cases. One that I have shown that I could achieve the dissection without creating any breaks, any additional breaks than they were already there. And the second case where I did not put the video because it was not very good quality was where I did bimanual surgery, and I found it to be very useful in bimanual surgery as well, because when we are doing dissection with bimanual surgery and cutter, the cutter really doesn't go under the membrane. It's a little difficult to hold the tissue with one forceps and then go under the membrane with the cutter. But with this instrument, I could go under the membrane and dissect and lift the tissue quite well. So the break formation in my hands was little less. I don't think anybody else has used this because I've just made it some time back. So, but it worked well even in complex diabetic retinopathy cases, even with bimanual surgeries.
Do you have a video of the instrument being inserted?
I'm sorry?
Port? Do you have a video of the instrument being inserted through a port?
Yes, I do have. I can show you later on.
We're done with the scoring? Yeah, we'll throw, because this is an innovative tool, I think there are some questions from the audience. So, ma'am, answer.
basically we are looking for something which has a sharp tip and is bevel up, right?
Yes, ma'am.
So what I normally do is with the needle, just bend it, bevel up. The needle has a sharp tip. At the same time, the bevel is up, so you have the advantage of creating a tear. You can tear whatever you want to without affecting the retina.
Okay.
So
Yeah,
just a comment.
Again, your tip of the needle, even though if you have turned it, it is very sharp. It can, can create probably it will create a retinal break in.
We have a similar instrument in Constellation called spatula, like what Kumar said.
Yeah.
That's available at 25, 23 too. And I use this a lot. Only difference is that yours is a little sharp, like a Crescent knife, whereas that is blunt.
So the problem with blunt instruments is that they are likely to cause more traction on the macula and
Yours is
rather
sharp,
macula and
yeah.
retina.
The
And
difference is yours is sharp,
yes,
so it gives you that plane easily.
it gives us plane and it gives clean dissection between the flimsy tissues.
Thank you, Dr. Mahesh.
Thank you, sir.
Good innovative instrument and